Dr. Vikki Petersen here. A listener asks, is it possible to gain weight being gluten sensitive instead of being underweight, which is so common with celiac disease? So she specifically asks, is it possible to be overweight and still have a gluten problem? And the answer is definitely yes. It's quite common with gluten sensitivity, but I understand where the question is coming from, and that is that so often with celiac disease, it is diagnosed in a patient who is extremely underweight. And it's because celiac has the unique trait, if you will, as an autoimmune disease of destroying completely the small intestine and your ability to absorb nutrients. And because of that, the person, often undiagnosed for on average at least a decade, has been malabsorbing for a very, very long time. They're not able to glean the nutrients from the foods that they're eating, and hence they tend to be quite underweight. And this is really one of the problems with diagnosing gluten sensitivity, is just this fact that all too often gastroenterologists and medical doctors are thinking that gluten equals severely underweight patient. So I've actually had patients go to see gastroenterologists explaining that this is their problem, only to have the doctor look at them and say, that's impossible, you're overweight, which is a narrow viewpoint, and what they're doing is they're confusing undiagnosed celiac disease with gluten sensitivity. So what happens with gluten sensitivity is you are still very reactive to gluten. It's causing you ill health, but it's not doing that rampage of destruction to the small intestine, and a different phenomena occurs as far as absorption. So it's not that nutrients are absolutely not getting into the system, and therefore the body is just sort of destroying itself and getting very, very underweight. More often what happens with gluten sensitivity is that the absorption is not as good as it should be, and there's a response that occurs from the metabolism of the body that I can best explain as this. So you're eating the food, it's coming into the mouth, it's not being well delivered to the cells, and so the metabolic rate, how fast your body is willing to burn what you're taking in, goes very low down. So these are people who are gaining weight, they've got more weight on their body than they would like, they're not necessarily overeating, and they're having trouble understanding why they're not eating a terrific amount, but the body just tends to keep getting bigger and bigger. And this comes from the fact that the body, because it senses it needs good nutrition that it's not getting, doesn't want to burn anything. So the body is basically holding on to everything that you give it and starts expanding in size. So gluten sensitivity, celiac, they're both problems with gluten, but they manifest themselves differently. It's the celiac who has been a long-standing celiac, has not been diagnosed for a good length of time, often has the underweight picture. Very often the gluten-sensitive patient has weight to lose. Now that's not exclusively the case. People can be of normal weight as well with gluten sensitivity, but it is not at all unusual to have a gluten-sensitive patient have weight to lose, only to find out when they get off gluten that they start losing weight. Actually, with our book, we had some publishing houses that wanted to push that point of weight loss associated with gluten. I declined to go in that direction only because I felt it would not embrace all the factors that gluten influences. If we just put it in the category of weight loss, that's really not fair to the neurological problems it causes, the autoimmune problems that it causes, the musculoskeletal problems that it causes. So to only put gluten in that category would not be doing it or all the people suffering from it a service, because it would be doing them a disservice, because there are plenty of people, as I mentioned, that don't have weight to lose. That's not their primary complaint, and if they did an equation of gluten sensitive equals overweight, then they wouldn't get help, because that's not really the major thing that they have occurring in their lives. So it is one of the things that gluten sensitivity causes, which is obesity, but there are many, many more. So I hope that helps, and until next time, I wish you very good health.